Gill. I'm one of the pediatric interventional radiologists in Atlanta, Georgia, and I work for Children's Healthcare of Atlanta, and we're also affiliated with the Emory University Hospital System. Our intent with this paper was to describe our experience of performing therapeutic procedures on acute and chronic systemic venous occlusions, offer suggestions about equipment, medications that you can use, the workup of patients when they present either to the emergency department or at an outpatient clinic setting, and then identify the barriers to successful management of this type of disease. So I hope that it just enables the discussion between IR and other specialties as these being an option for patients with acute or chronic venous occlusions. And while IR may not be a solution in every case, for us to begin to be consulted at least and to weigh in on the decision-making power of the collaborative team, I really believe it adds a lot and will ultimately result in the best care for the patient. Also, it should be able to help IR be a resource for clinicians on determining the best workup for the patients so that we get the most accurate and lowest radiation dose possible for the patients when we're trying to diagnose exactly what the problem is. And then eventually, I hope it would provide better suggestions of equipment that is currently available for use in pediatric systemic venous occlusions. And just with the side note that we know equipment is constantly changing, I think a realm of possible interest for the future would be to look at some of the suction thrombectomy devices, such as the Inari, or there's other new devices out there that are currently being tested in the adult IR realm, and whether those have a good and a safe application in the pediatric population remains to be tested. So I think this is probably one of the most important questions is what does this eventually mean for the patient? And hopefully what this work will do is be able to provide symptoms that are much less severe when you're talking about post-thrombotic syndrome for patients. So less risk of them having lifelong complications from having a DVT. And that's huge. I mean, it's important for adults, but it's even, I believe, much more important for our pediatric patients because they're maybe limited for the rest of their life with this type of a problem. I think it can also, when we talk about recanalization of systemic deep veins, that will hopefully alleviate some of the need for lifelong anticoagulation in some pediatric population. As you're able to establish a more inflow route for the blood to drain and less risk of having another blood clot in the collateral circulation. And then finally, also for the patient, although they may not realize it at the time, is better, more efficient imaging workup when they're being diagnosed with the condition.